Congresswoman, what can Democrats do to stop this health care plan from being enacted into law?
Well, our job is to shine a spotlight on the abhorrent piece of legislation that we have on the floor later today. It's going to take coverage away from 14 million people a year from now, 24 million over the next 10 years, increase costs between 15 and 20%, impose an age tax, and if the Republicans fully have their way, take away essential health benefits that are going to leave people not only uninsured, but underinsured.
There was another piece of information in that CBO report that came out last night about premium costs, particularly for low-income Americans. Yes. What can you tell us about that?
Well, the premium costs for low-income Americans will go up about 15 to 20% under this legislation. That is even worse than the original bill that they had on the floor. And this is remember, this is the Congressional Budget Office, which is an independent, nonpartisan organization whose director was appointed by the Speaker of the House and Tom Price, our current Health and Human Services Secretary. So this is their best experts analyzing their legislation, and as they've said, it's only the beginning.
So help me out here, because for people outside of Washington, outside of the bubble, they're looking at this and they're seeing the White House negotiate with the House Freedom Caucus and conservative members. They're not seeing any negotiations with Democrats. What do you say to people who are removed from politics and are just looking at this and saying, why can't Democrats and the White House sit at the table, be in the White House, work out a deal, improve Obamacare, and get a deal?
Well, that's exactly our question. What we need to do, and what we know Americans want us to do, is they want us to sit down together. We acknowledge, and have always acknowledged, that Obamacare isn't perfect. The Affordable Care Act needs revisions so that we can make sure that we address the fact that there are about a third of the counties around America that only have one provider.
A lot of them rural communities.
Yes, and we absolutely need to make sure that we can create more competition in those communities. But it doesn't mean that you take a sledgehammer to a clock that's running a little slow. You sit down and you make some fine-tuned precision changes. You work together, especially now that we actually have Republicans finally saying that they supposedly agree that everybody should have access to quality, affordable health care. But their version of the legislation only provides what they call access, not coverage, and certainly not comprehensive coverage, and that's unacceptable.
When you take a step back in terms of being in the minority party now, an agenda and what's going forth, what is the strategy for Democrats as a whole, not just in the House, not just in the upper chamber, but also just as a party as a whole moving forward?
On health care reform?
On everything.
Well, I mean,
it all seems to be moving so fast, as you know.
You know, we have an administration that simply can't be trusted, and a president who doesn't tell the truth. And, you know, in my experience, growing up with my family and what I teach my own children, when you have someone who repeatedly lies over and over, it means that you pretty much can't trust anything they say. You've got a president who's under investigation, and his campaign is under investigation for collusion with the Russians. We have a very disturbing situation that calls into question the entire legitimacy of the election.
What do you make of House Oversight Committee Chairman Devin Nunes's comments?
I think his conduct has been outrageous and disturbing, and has demonstrated that he's compromised himself in terms of his ability to actually neutrally oversee this election. Why?
Time for a special prosecutor?
It has always been time for either a special prosecutor or an independent, bipartisan investigation, a select committee impaneled to make sure that we can truly have someone leading the investigation that is above board and that isn't, a lackey for the president. When is it ever appropriate for the investigator to go running to the target of the investigation to provide them with information that they've received?